what you must have to tell them, that DVT most common site, it is
Calf
your
region.
calf veins.
Calf region.
Okay, calf
Soleal veins.
region or
Okay.
calf veins, it is the most common site, or it is also known as soleal
Soleal.
veins. Okay, DVT most common, it is calf veins or it is your soleal veins. And DVT, it is the formation of blood clot within a deep vein. Okay, it is the formation of a blood clot within a deep
Okay.
vein. And what are the factors which can lead to the formation of this deep vein thrombosis? It is your virtuous
Richard
triad.
triad.
Virtuous triad, it is She. S
See.
H
Let's
E.
see.
S is
Hypercoagulation.
stasis. Okay, stasis. H is hypercoagulable state. E is endothelial injury. Okay, or endothelial damage. So all these factors, virtuous triad, can result in deep vein thrombosis, and most common site for deep vein thrombosis, it is the calf veins, it is the soleal veins. And please remember, if deep vein thrombosis occur in large veins, it can detach, and when this thrombosis detach, it results in a formation
Pulmonary,
of emboli, and it results
pulmonary,
in a complication known as
Pulmonary embolism.
pulmonary embolism.
pulmonary emboli.
And which large veins? These are your thigh veins. So please remember, DVT most common calf veins, soleal veins. But if DVT is occurring in the large veins like the thigh veins, or you can say your femoropopliteal veins, it can result in pulmonary embolism. It can result in what? Pulmonary embolism.
Pulmonary
Pulmonary
embolism.
embolism.
Okay, so these points you must have to remember. And please, another point which you must have to remember here, that DVP, DVT, it is associated with long surgical procedures. Long surgical procedures, it can result in DVT. For example, major abdominal surgical procedures, major pelvic surgical procedures, orthopedic surgical procedures, all these large time procedures, it can result in DVT. Okay, or prolonged immobilization. For example, if you are driving a car for longer time periods, or if you are, for example, in a long flights, okay, in long flights, it can also result in DVT. And when it results in DVT, the symptoms will be what? Pain in the calf region. The patient will develop pain in the
Swelling.
calf region. So when the patient will develop pain in the calf region, it is the you can say it is the sign of your DVT, or the earliest sign of the DVT, pain in the calf region, because your calf veins, soleal veins are involved. Okay, so this is your DVT. And please remember, when DVT
Triad.
occurs, because it is the problem of the veins, DVT, this is deep vein thrombosis, so it is the problem of the veins. One important point which I want all of you to be very clear here. See here, thrombosis can occur in arteries, thrombosis can occur in veins also. Okay, thrombosis can occur in arteries, thrombosis can also occur in the veins. But when thrombosis is occurring in the arteries, see here everyone, there will be more formation of collection of platelets are more here, and there will be less formation of fibrin. Okay, when there is a thromb formation in the arteries, but if there is a thromb formation in the veins, if it is a thromb formation in the veins, there will be less accumulation of platelets, but there is more accumulation of
Fibrin.
your fibrin. See, more fibrin is forming in the veins. So this is a very important point which you all must be clear. So that's why if patient develops, see here everyone, first of all, if patient develops thromb in the arteries, you are going to give anti-platelet drugs to the patient because platelets are more here as compared to fibrin. Okay, so you are going to give which drugs? Anti-platelet drugs.
Antiplatelet.
Okay, but if the thromb formation is in the
Vein.
veins, because there is
Anticoagulant.
more formation of fibrin here, so you are going to give anti-thrombotic drugs. Anti-thrombotic drugs. You are not going to give anti-platelet drugs in patient with thromb formation in the veins. Okay, but if there is a thromb formation in the arteries, you are going to give anti-platelet drugs like clopidogrel, like aspirin. What they are going to do, they are not going to allow platelet aggregation because there is more platelet aggregation in arterial thrombosis. But in venous thrombosis, there is more formation of thromb, more formation of fibrin, less platelet deposition, so your treatment will be anti-thrombotic drugs. Which drugs? Anti-thrombotic drugs.
Antithrombotic
And
drug.
please remember anti-thrombotic drugs. Anti-thrombotic drugs. You are going to give heparin to the patient.
Heparin.
You are
Warfarin.
going to give
Warfarin.
warfarin to the patient. Now listen here, first of all, everyone. Heparin and warfarin. How you are going to remember it? Heparin and warfarin. The mnemonic is, see here, everyone. The mnemonic is sorry, here. The mnemonic is WEPT. WEPT. Heparin. The mnemonic is HINT. HINT. So see here, warfarin, it is acting on extrinsic coagulating system, extrinsic pathway, and you have to check the PT level of the patient. Heparin, heparin, it is going to act on the intrinsic pathway of the patient, and you have to check what? APTT.
INR. APTT.
APTT.
1.5 to 2.5 range.
Okay, APTT. So see here, everyone. Warfarin mechanism of action. What is the mechanism of action of warfarin? It is going to block your 2, 7, 9, 10 clotting factors. 2, 7, 9, 10, protein C, protein S. And all these factors, they are activated by vitamin K. So warfarin is going to block your these clotting factors which are activated by vitamin K. So that's why whenever you are giving warfarin to the patient, you have to check the PT levels. Okay, prothrombin time, PT. But nowadays we are also doing INR also. So PT and INR should be done in all the patients if you are giving warfarin. Okay. And please remember warfarin antidote. It is also an MCQ. Warfarin antidote. It is your vitamin K because it is blocking vitamin K, and it is your fresh frozen plasma. Fresh frozen plasma. So it is the antidote for warfarin. For example, patient is having DVT. You are treating it with heparin. First of all, you have to give IV heparin to the patient. Then you will bring the patient to the warfarin. But when you are giving warfarin, you must have to check the PT levels of the patient. And the antidote for it will be vitamin K or fresh frozen plasma. Heparin, see here, heparin. It is acting on the intrinsic pathway. So you have to check the PT levels, APTT levels of the patient. Okay, you have to check what? APTT levels of the
level.
patient. And antidote for heparin. What is the antidote? Protoamine sulfate. Protoamine sulfate, it is the antidote for heparin. So that's why if you are treating the patient with DVT, okay, if you are treating the patient with DVT, you will start from heparin. Okay, and you are going to use low molecular weight heparins. Okay, low molecular weight heparins for prophylaxis also and for acute management also. Okay,